I don't have slides, and I'm going to talk quickly because I want Tom to be able to talk from the Innovation Center because a lot of you have heard me drone on before, and he's going to be more interesting. But I'll give you just a brief background on CMS as a whole, and then he'll be able to talk specifically about what we're doing at the Innovation Center. So just to give you a little background on myself, I am a nephrologist. I practiced for 5 years in academic pediatric and adult nephrology. I actually trained at the University of Michigan. I rounded with Dr. Fussell way back in the day. He decided to do the research on this stuff, and I decided to do research on health outcomes. And so I looked at lots of data, realized that the outcomes for people on dialysis aren't great, and we spend a ton of money on it. So that's one of the reasons why I decided to come into government, to try and see how I could affect things from this sort of perspective. So with that background and why it's important to me to work for patients, when I got to CMS, it was sort of like, I've been there 2 years now, and I still don't feel like I completely understand everything that's going on there. And when I got there, I was like a deer in the headlights. But what I did notice was that when I came to meetings like this, everyone was like, we need CMS to help us with this, and CMS doesn't communicate enough with us, and what can we do to get people to pay for it? And the reason that innovation isn't moving forward is because people are unsure about payments and whether their devices are going to be paid for. So, and a lot of those things are true, and we haven't done as good a job as communicating as we could have, but we are trying to change that now. I'm the only nephrologist there, so it's a little hard for me to do everything, but no. So we sort of look at it from a couple of different perspectives that we've been focusing on at CMS. So one is more patient engagement. So we've had a lot of push to get more patients on all of our panels. Every decision we make, every expert panel we have now has a significant number of patients on it, and they have all communicated to us that we need to be more flexible in our innovation and what we pay for. We're somewhat limited by what we can do with Congress, but there are things that we've been able to find that we can do. So just to explain to you how it sort of works with payment, there are two different entities at CMS. One determines coverage, so one says coverage yes or no, and then a separate group says payment, how much. So, and they don't talk to each other as much as they probably should. And I think over the past 2 years, since we got direction from the administrator to do that we have been talking a lot more. So that is probably the biggest step that's going to happen to increase innovation, is having those two be able to coordinate more. The second step is to sort of figure out, so dialysis is paid for in bundled payments, which is why everyone's so hesitant to think about how this stuff is going to be paid for. Is it going to be part of the bundle? Are we only going to be limited to that amount? So what we've tried to do is figure out other types of ways that something could be paid for, whether it's to classify this as durable medical equipment, or whether looking at different settings and whether we could get payment for that. And what we've been trying to do, and it takes a little while because it's a large agency and getting people to agree is difficult, but we have been working on looking at alternative ways that we can give people guidance as to ways that this could be paid for potentially outside of the bundle. It's hard to know that for sure because everything is hypothetical, because we don't have an actual device that's come in front of us, but we can give some guidance as to how things might particularly go. We are still working on that. That's been in progress for probably about the past 6 months, trying to figure out exactly how we're going to do that. But it's something that we'd like to make public as part of the this part of our involvement with KidneyX. One of the other things that we've been doing also is working more with the FDA. So we do have the parallel review process. It's pretty early. It was a pilot program. I think a year ago it was given more than pilot program status. But they're still early. It's still early, and not a whole lot of things have been reviewed through that process. But it is progressing, and that is an option available to us. And one that as the coverage group gets more experience with kidney things and seeing more kidney things, being able to ramp up that the use of that. And so collaboration between government agencies and collaboration between CMS components has been sort of an important thing to help us foster innovation. And then we have the Innovation Center, where I think a lot of these things can potentially be used and payment can be done through that. So I will turn it over to Tom so he can talk to you, because we're running out of time and I want to be able to have a discussion afterwards. But we are committed to working with our federal partners and working with the community and working with patients to foster innovation. We realize this is important. We realize there have been barriers. We realize we haven't been as good about this in the past, but we have been working hard to try and communicate that with you. And that's it. Thanks.